My name is Bruce Campbell. I'm one of the stroke neurologists at Royal Melbourne Hospital. We thought we'd talk a bit about both how to prevent stroke and also how to recognise stroke. And so first of all, preventing stroke is something that all of us should have an interest in, because about 1 in 6 of us will have a stroke at some stage of our life, and it's obviously a major cause of disability in our society. People worry about death, but they tend to worry about disability even more. So most of the risk factors with stroke are shared with other cardiovascular diseases like heart attacks and so on, and peripheral vascular disease. And so, you know, the things like smoking, it's an obvious one, but clearly if people are still smoking, that's a major risk factor for so many health problems, cancers and heart disease and stroke and not being able to breathe. So we strongly advise people to find a way to get off the smokes. Blood pressure is a major risk factor for stroke, particularly the bleeds inside the brain. I probably should have mentioned that, you know, about 80% of strokes in Australia are caused by a blocked blood vessel in the brain. Some clot forms in the heart or the neck vessels, goes up to the brain, reduces blood supply. But the other 15% or so are predominantly bleeds, and that's where a blood vessel is weakened, usually by long-standing high blood pressure, and then it bursts and there's bleeding into the brain. So that type of stroke with bleeding is particularly related to high blood pressure, but high blood pressure is a risk factor again for all types of stroke, all types of heart disease. Cholesterol is less strong as a risk factor for stroke, but clearly is not good for your vascular health. Heart attacks is a big risk factor, and we certainly treat people's cholesterol aggressively if they've had a stroke or a warning stroke called a TIA. Diabetes, like all diseases, is a problem, and of course there are a lot of lifestyle factors that feed into those risks. So if you're inactive and sedentary and couch potato, the classic Norm from the Life Be In It ads, then that's going to increase your risk of diabetes and increase your risk of stroke and high blood pressure and overweight and all those things that all cluster together. There is one particular risk factor specific to stroke, which is called atrial fibrillation, or AF, and this is something a lot of people have never heard of, but it's an irregular heart rhythm. So in your heart there are 4 chambers, and usually the little ones at the top pump, and then that fills into the main chamber and goes to the rest of your body. And in atrial fibrillation, the little chamber at the top sort of flapping in the breeze, and that abnormal blood flow, the stagnation of blood that results, can form blood clots in the heart, which can then travel up to the brain and cause a stroke. And that's a major cause of stroke. There's an epidemic of atrial fibrillation, particularly as the population gets older, and people are tending to survive their heart disease in their 50s and 60s and then develop atrial fibrillation later in life. And that's something that's very treatable. We use blood thinners, if you like, anticoagulant medications. In the past it was a medication called warfarin that got a bit of a bad reputation. It's a bit complicated to take, but there are now some good tablets that don't require that degree of monitoring and less restrictive on your food and medication intake. So have good treatments for atrial fibrillation, and people should make sure that they're being screened for that when they see their GP. Have a blood pressure check, make sure the pulse is regular. You can feel your own pulse, it's pretty easy. You just put 2 fingers just there, and you should feel a nice regular pulse. It's rhythmic. So those are the main modifiable risk factors. Obviously things like age and your gender you can't change, and your family history you can't change, but if you can get your blood pressure checked and make sure you're not diabetic, make sure you're exercising regularly and eating a healthy diet, all those things will dramatically reduce your risk of stroke. We think about 90% of the risk for stroke is modifiable, and that's a lot that we can all do for our own health. So moving on now to what actually happens when you have a stroke. As I mentioned, in most cases it's due to a blocked blood vessel in the brain, and that means whatever part of the brain is supplied by that vessel stops working, and that could present in pretty much any way that your brain presents, but brain functions, but usually it's weakness down one side, or trouble with feeling down one side, or vision out to one side, or trouble with your speech, which could be slurring, you know, the good old Southern, I'm not very clear in my speech, or you know, getting the wrong words, which is actually a language problem. So we have a message that we try to promote called FAST: face, arm, speech, time. So FAST. The face if it's droopy, the arm if you can't hold it up, or for that matter your leg. Speech if it's slurred or incomprehensible. All of those things should prompt a call to 000, not to your family, not to nurse on call, but call 000 those are the guys that will recognise whether it is likely to be a stroke, and they'll bring you to the right kind of hospital where you can get the treatment that you need. There is a lot that we can do for stroke if you come quickly. All the treatments are time critical. Every minute that goes by, there are brain cells dying, and reduces our ability to impact stroke. So keep in mind the FAST message, the face, arm, speech, time. Also, clearly it can affect things like people have vertigo, which is a spinning sensation. Lots of things that can cause that, but in some contexts that's a stroke. You can have trouble with double vision, where you're seeing two of things. You can have pretty much, as I said, anything that the brain can conjure up, but the majority are face, arm, speech. Call 000. Don't drive yourself if you've suspected having a stroke. So I think I'll leave it there, but I look forward to chatting to some of you at the Google Hangout.